When a victim of sexual assault seeks medical attention, where they go for treatment can ultimately mean whether or not the attacker ends up behind bars. In tonight's Your Life, Your Health, Julia Dunn explains the key component that some local hospitals have to help the victims and the prosecutors.
Kaylin Dawson is a specially trained nurse for victims of sexual assault.
Our youngest victim is 7 weeks old, I believe, and our oldest was 96. And we have both women and children, and as well as males that come in.
It's one of many hats she wears at Albany Medical Center. It's the only hospital in the region staffed 24/7 by nurses and doctors, trained not only to treat sexual assault victims, but carefully collect forensic evidence to put an attacker behind bars.
Instead of a normal forensic investigation where a forensic investigator will go out and collect evidence at a crime scene, for these patients, the crime scene is sometimes their own body.
Dr. Chame Blackburn heads up the sexual assault forensic examiners team at Albany Med.
What that means is instead of a patient coming into the emergency department and waiting for a long time to be seen or to be passed over by very critically ill patients, we have on-call examiners who actually come in, who have been trained in forensic evidence collection, in taking care of sexual assault patients.
The exam is done using a special kit to collect evidence for police and prosecutors. All emergency rooms in New York State are required to have these, but in a busy ER, if physicians are unfamiliar with its complexity, time-sensitive evidence could be compromised.
So to leave a bunch of other patients to go do this kit sometimes falls down on the priority list.
Medications are offered following the exam to treat infections or test for HIV. Dawson even follows up with her patients, in particular one victim of rape in Albany several years ago.
It shows her process through and how thankful she was that she had the support system.
Wishing not to be identified, she instead shares this letter saying, "I chose to report my crime, have a rape kit done, and to go through with a trial through the district attorney's office. Every single step of that process was difficult, but I'm happy with my decisions." And with any SAFE program, it's the victim's decision whether to report any sexual crime. In Albany, Julia Dunn, CBS 6 News.
And by the way, Albany Med's SAFE program is one of the oldest programs of its kind in the state of New York. It started in 1998. Despite this, many sexual assault victims may not know that that service is available to them, something they're hoping to raise some awareness of.